everyone, my name is VImi Gupta. I'm a psychotherapist who's been practicing for the past 27 years, 27 to 28 years. Time goes on so fast. But the reason why I'm making this video is I realize that this is important information that I do want to share, and I feel like if it can help just one person or their families, it would make a really big difference. So, as you might guess, in my practice these days, we've been talking a lot about the coronavirus and loss of jobs, things associated with it, feeling isolated, and feeling like a little bit of hopelessness as well. Relationships are sometimes suffering because everybody's in an enclosed space. So all those things are there. But through this process, one thing that I'm learning is that we're also developing new approaches. We're also getting better at certain things and getting a routine and accepting some of this stuff. So first, what I want people to know about is a little bit about the coronavirus that I've learned. And the reason why I'm sharing that is because I think it gets lost in all the noise, the conflict, the political stuff, machinery that news channels now are focusing on, rather than actually human health and American health. So first, this coronavirus, when it does come into our system, it affects people differently. We didn't know that before, but we know that now. Obviously, we know that some people are asymptomatic, they have it and they're giving it to others. We also know that the people we really know about are the people who end up in the hospital. They get a fever, a cough, some head pain, maybe nausea or diarrhea, and difficulty smelling and breathing. So we keep hearing this. Those people get, sometimes it gets so bad they get on ventilators, and we hear about them passing. The people we don't hear about as much are people who have this thing called long COVID, or people who have other symptoms and are somehow dying of other symptoms like strokes and other heart-related symptoms in the kidney, in the brain. And so now it's clear that the virus is going, if it gets solved in the lungs, doesn't mean that it just stays there. If our lungs are strong, we don't smoke, all these things, we've confined it a little bit better, but it tries to go where it can, so if it ends up in your brainstem or in your brain, it'll start, creating problems there. And then it could also go into our veins, and they're finding that it is doing that. Some people are getting some weird inflammation in their toes, and you've also heard about children getting the strange inflammation. So it is affecting different parts of the body. The thing about that form of COVID is that doesn't get talked about, and sometimes it causes damage, but it's slow damage. So a person is slowly realizing that something's off. My muscles hurt, I can't move, I don't want to do anything, what's wrong? And it's not identified because there's no fever or congestion. Typical cold-like kind of lung-related symptoms. So what is causing some of that? If our body did fight it, what is causing some of it? Well, it's our own body. And why we cause some of it is because our body doesn't recognize this virus. And when it sends our soldiers, which are our antibodies to fight, it sends maybe a little bit too many, and they bring too much equipment, and because they're desperate to fight it, so they just come, and that's why you get that congestion. They all come, But what they do is sometimes they overstay their welcome, and your body gets inflamed in those areas. And this is what is called the cytokine storm. And if you read about it, you should read about it, because if you're feeling any form of inflammation anywhere in your body, it's real. And if you're feeling it only in the past 3 months, it's real. Don't ignore it. Try to do something about it. The reason why I know about it is, one, I have some kind of pain in the back of my neck and head. Two, I read some journals like the Neuroscience News and Neuropsych News journals, which kind of expose me to the stuff like outside of the noise, the political noise. So I get like articles that say brain inflammation, people getting weird things on their toes, and how it's affecting the brain, and what kind of cognitive disorders. A person of cognitive disorders means thinking disorders. So I learn about those things, and then I feel sad that not so many people know about it, and maybe they're suffering. And fortunately, when I work with my clients, I share this with them so that they can make the best choices for themselves. And so that's something I wanted to share. The second thing I wanted to share is we're going through a tough time, and we're hearing a lot of things from different political sides about this virus. And what I want to share is something that's going on psychologically with some of the groups of people in our country. So there's one group of people